My name is Dr. Romila Ragaven, and I'm a clinical psychologist. I specialise in perinatal mental health, but I also have a special interest in breaking generational cycles. Could the trauma you experienced during childhood be affecting how you parent? Your experiences during childhood can have a profound impact on how you parent. Our early years shape the way we see the world, how we understand relationships, and how we respond to stress, all of which play a role in how we raise our children. From birth to adolescence, our brains are highly plastic, meaning they're constantly changing and adapting based on our experiences. The relationships we form, especially with our primary caregivers, teach us about trust, love, and safety. If these relationships were nurturing, we often carry forward a sense of security into adulthood. However, if our earlier experiences were marked by inconsistency, neglect, or trauma, we might develop different coping mechanisms that can later affect our parenting. One of the most common ways childhood experiences influence parenting is through the repetition of patterns. We often unconsciously mimic parenting styles we were exposed to as children. If your parents were strict and used discipline as a primary method of control, you might find yourself leaning towards similar methods, even if you don't intend to. On the flip side, if you were raised in a permissive household, you might struggle with setting boundaries for your own children. These patterns can be beneficial, but they can also be limiting or even harmful if your childhood was difficult. For instance, a parent who grew up in a household where emotions weren't openly expressed might find it challenging to be emotionally available for their own children, leading to a cycle of emotional distance. Our childhood experiences can also create emotional triggers that affect how we respond to our children. For example, if you were often criticized as a child, you might be particularly sensitive to any behavior from your child that feels like rejection or criticism. This can lead to overreacting or feeling hurt by your child's actions. Understanding your triggers is really important. When you notice an emotional response that feels out of proportion to the situation, it's helpful to ask yourself whether it might be rooted in your own past experiences rather than your child's behavior. This awareness can prevent you from projecting your past onto your child, allowing you to respond in a way that is more appropriate and supportive. The role of attachment styles. Attachment theory, developed by John Bowlby, suggests that the type of attachment we formed with our primary caregivers in childhood influences how we relate to others throughout our lives, including our children. Now, there are four main attachment styles. Firstly, secure attachment. This is typically formed when a child's needs are consistently met with warmth and responsiveness. As a parent, if you have a secure attachment style, you're likely to be attuned to your child's needs, fostering a similar sense of security in them. Secondly, we have anxious preoccupied attachment style. This can develop when a child experiences inconsistent caregiving. As an adult, you might be overly anxious or concerned about your child's well-being, sometimes to the point of overprotectiveness. Thirdly, we have dismissive avoidant attachment style. This is often the result of a caregiver being emotionally unavailable. Parents with this attachment style might struggle with closeness and may inadvertently distance themselves from their child emotionally. And fourthly, fearful avoidant attachment style. This is a mix of anxious and avoidant behaviors, typically stemming from trauma or severe neglect. Parents with this attachment style might find themselves caught in a push-pull dynamic with their children, wanting closeness but fearing it at the same time. Understanding your own attachment style can provide insight into your parenting behaviors and help you make conscious choices about how you interact with your child. If you recognize that your childhood experiences are negatively affecting your parenting, it's important to remember that you can break the cycle. Here are some steps you can take. Firstly, self-reflection. Spend time reflecting on your childhood and identifying the patterns that might be influencing your parenting. Journaling, therapy, or simply talking with a trusted friend or partner can be helpful in this process. Secondly, therapy. Working with a therapist can provide you with the tools to understand and change unhealthy patterns. Therapists can also help you heal from the past wounds that might be affecting your ability to parent in the way that you want to. Thirdly, mindful parenting. Mindfulness practices can help you stay present in the moment and respond to your child's needs without being overwhelmed by your own emotions. Techniques like deep breathing, meditation, and mindful listening can be particularly beneficial. Fourthly, education and support. Parenting classes, books, and support groups can provide valuable insights and strategies for parenting in a way that is informed, both by your past and your current goals as a parent. Learning new approaches can help you create a parenting style that feels authentic and positive. Fifthly, reparenting yourself. This concept involves giving yourself the care and nurturing you may have missed out on as a child. By addressing your unmet needs and healing old wounds, you can become the parent to yourself that you wish you had, which in turn can transform how you parent your own children. While your childhood experiences undeniably shape you, they don't have to dictate your future or how you parent. By bringing awareness to these influences and actively working to understanding and reshape them, you can create a parenting style that is uniquely your own, one that reflects your values, your love for your child, and the lessons you've learned along the way. Remember, parenting is a journey, and every parent brings their own history, strengths, and challenges to the table. The fact that you're even thinking about these issues shows that you're committed to being the best parent you can be, and that's something to be proud of.